every once in a while when we post something like this, someone will sort of defensively reply with, anxiety or depression, it's a disease and we shouldn't be talking about treating it with something like time in nature or sauna therapy or exercise. And I kind of understand that perspective, but it misses, I think, the bigger point. Hey everyone, welcome back. Let's discuss a number of exciting research studies that can inform our opinion, not cherry pick, but tell us how to better use natural health tools, in this case to improve depression, anxiety, fear of food. We'll touch on psychedelics, coffee and its health benefits or not, blood pressure, and heart disease. So again, let's unpack what myself and our research team are taking away from this ever-growing stream of research in natural therapeutics so you can use these things to have a better mood, better quality of life, know if you should or should not drink coffee, etc. And here's a recap, or an overview, I should say, of the studies that we're going to review, and I'll recap at the end. Regarding mental and emotional health, does vitamin D improve depression? Does fiber intake associate with improvements in depression? Can exercise improve anxiety? And if you've suffered with anxiety, as I have at some points, I would do anything to get out of feeling anxious. It's the worst. Can simple mind-body treatments resolve depression? Do elimination diets increase the risk of eating disorder? Can ketamine improve eating disorders? Can psilocybin improve alcohol abuse? Can mindfulness improve long COVID symptoms? Can it also reduce ulcerative colitis flares? And then we'll come around to a sip on the topic of coffee and cardiovascular health, omega-3s and cardiovascular health, arginine and blood pressure, and if a combination of aerobic training along with strength is better than strength training alone. So let's kick off with a number of studies on mental and emotional health. The first study, an umbrella meta-analysis. So it's a study of meta-analyses, or it's a summary of meta-analyses. In this case, looking at 14 meta-analyses, looking at the administration of placebo or vitamin D. Now, the vitamin D dose ranged from about 2,500 to 6,000 IUs per day, so a pretty reasonable dose, not a high dose. And compared to placebo, what you see here on this great slide by the authors is that vitamin D supplementation did lead to a small but noteworthy decrease in depressive symptoms. Also, for those who had low levels of vitamin D at baseline, they had a higher odds ratio of being depressed. So we see two things. One, we see an association to low vitamin D and depression. And also, we see therapeutically that vitamin D supplementation can at least have a small but significant impact on depressive symptoms. So great news for vitamin D. The next study, a meta-analysis, wanted to ask the question and answer it: does fiber intake associate to depression? And the answer here is yes. What they found was a 10% reduction in depression in adults and a 57% reduction in depression risk in adolescents with essentially with progressively higher fiber intake. There was a progressively lower incidence of depression. For every 5-gram increase of fiber, there was a 5% lower chance of depression. What we don't know from this study and what we were unable to pull out from the paper was very adequate control for healthy user bias. What we could be seeing here is that fiber is truly protective. What we could also be seeing is that people who are eating more fiber are eating a generally healthier diet, lower in processed foods, added sugar, and may also have a clustering with other healthy lifestyle factors. So there could be a healthy user bias here. Not sure, but in any case, I think it's reasonable to say to a degree, try to increase your fiber intake. If you hit a point at which you're bloated, you're gassy, you have constipation, then you may want to pull back. There is, in my opinion, a Goldilocks sweet spot regarding fiber intake. Usually the more symptomatic that you are, the more likely fiber may flare you. And then with time, as your gut becomes healthier, a larger intake of fiber is usually tolerated. So very interesting meta-analysis there. The next study looked at resistance training and its impact on anxiety. This was a randomized control trial with about 30 women who had either a control intervention or strength training, and only twice per week, so not a very lofty goal. And after 2 months, compared to the control, the strength training led to improved HRV, heart rate variability, and also a large effect size in reducing anxiety. So, one simple thing you can do to improve mood, every once in a while when we post something like this, someone will sort of defensively reply with, anxiety or depression, it's a disease and we shouldn't be talking about treating it with something like time in nature or sauna therapy or exercise. And I kind of understand that perspective, but it misses, I think, the bigger point that a lot of these diseases, not all, but a fair number of them, I would argue, certainly depression and anxiety, are downstream to things that we could be doing better upstream, like your sleep, like your lifestyle, including exercise. So you don't have to pick one or the other, but many diseases will go away when your genes, your body is in the most healthy environment, which in this case includes strength training twice per week. Now, this next study looked at 88 menopausal women and wanted to know if a simple mind-body technique could improve depression. So they were divided either into control or this EFT, emotional freedom technique group. And here's what this looks like. It's essentially tapping or putting pressure on acupressure points. And admittedly, the first time I heard of this, I thought, it sounds a little bit airy-fairy. I'm not really sure about this, while also being very open to things in alternative medicine, obviously, and traditional Chinese medicine, acupressure, acupuncture. But I think many of these therapies are best run through a filter of science to make sure there's not a placebo effect. Now, that being said, if doing something like temporal tapping reduced migraine or in this case improved mood for essentially no cost at all, and it's not anything too time intensive, I would say, okay, maybe even if it's only a placebo effect, it's worthwhile. But this study looked at that. There was a control and an intervention group. And what they found was essentially a reduction, a cutting in half of the risk of depression from a 63% response rate in the treatment group and a 34% response rate in the control. Wait a minute. So the control that was just essentially nothing, or a non-therapeutic placebo, had a 34% increase or improvement rather in their depression, whereas the treatment group had a 63% increase in their improvements in depression. Yes, this is because placebo does have an impact. So this is why the placebo control setup is so important to be able to parse out the relative effectiveness. So in this case, after 2 months, there was a doubling of the improvement in depression when using this EFT emotional freedom technique, which you can look up fairly easily online. And it's something I may even consider experimenting with myself, given these findings. Now, as it pertains to mindset, something that's very important to find the correct balance point for is diet. Like we've discussed on the podcast so many times in the past, it is easy to fall into, well, someone's saying that gluten is bad. Someone else is saying that dairy is bad. There's also the lectin guru. There's a salicylate person, and there's information on histamines and tryptase inhibitors and whatever. You can very easily fall into a unhealthy relationship with food. And this study, I think, is a really poignant reminder of that. Observational study, 410 adults, 129 children, all with gastrointestinal symptoms. And they found that a history of elimination diets were associated with a 3 times increased risk of development of an eating disorder. So for healthcare providers and for patients, we all collectively have to start handling the conversation about diet with a bit more care and be careful to educate on foods that can promote health, yes, and also foods that we may want to reduce or be somewhat avoidant of, also yes, but not fall into this absolutist thinking, which is very pervasive, especially with gluten. And the amount of people that we'll see in our practice who come in absolutely afraid of gluten, devoid of any evidence to support that they should be, is just one shining example of how we're not handling this conversation appropriately. Remember that non-celiac gluten sensitivity has a prevalence range of anywhere from 0.3 to 10%. So to frame this discussion as everyone has a problem with gluten is incorrect. This also applies to Hashimoto's thyroid autoimmunity. One of the best studies that looked at this in over 12,000 participants by Volta, they found a 9% prevalence of thyroid autoimmunity in those who had gluten reactivity. So in those who were already reporting they didn't feel well on gluten, there was only 9% of those people who had thyroid autoimmunity. So this tells us that yes, non-celiac gluten sensitivity is a thing. Yes, there is an overlap to that with Hashimoto's, but no, it's not everyone. And we should go through the practical exercise of looking at how you respond symptomatically to gluten to determine if you do or do not eat it. Why? Because of evidence like this. Because you're at risk. You're at 3 times risk for development of an eating disorder if we don't handle this conversation appropriately, responsibly, and give you these data on your risk of about 0.3 to 10% of the population with celiac as just one example, or I should say non-celiac gluten sensitivity. Now, for some people, it's clear that the level of fear of food is fairly deeply ingrained. And this is where cognitive behavioral therapy, mindfulness, meditation, or in some cases, ketamine therapy may have merit. So in this study, albeit small and non-controlled, 5 women who were struggling with a persistent eating disorder were given a ketogenic diet and ketamine IVs, 6 infusions over 3 weeks. And after 6 months, there was an improvement in eating disorder symptoms, body image concerns, and weight concerns. So this is an exciting finding. I think this has applicability to those who may not want to do mindfulness, who may not resonate with something like limbic retraining, who perhaps are too busy. There are some people for whom those types of interventions don't seem to be a good fit, or they don't resonate with the individual. We at the clinic have been making some referrals to people to look into local ketamine centers when they come in with this sort of presentation. It's too early for me to report back on what we're seeing, but we are going to be having the author of this paper, or one of the authors, on the podcast to discuss their findings. And one thing I will probe into is how assured can we be of the results given that there was no control? Because we do want to control for placebo. And in this case, given the fact that an infusion session will tie you up for at least 2 hours, if not also maybe an hour or 2 afterwards, and the cost may be $1,000 or more. This is where being discerning regarding the placebo effect makes a lot of sense. So interesting therapy, and one that we will be having a follow-up conversation on hopefully very soon. Along with this, a bit more studied, or maybe not more studied, but I think psilocybin has been longer in the prism of scientific research, even going back into the 70s, 80s with kind of the Timothy Leary crowd, and it kind of had a little bit of a hiatus and now is having a renaissance. 93 participants. And in this case, the setup was great. There was either psychotherapy plus placebo or psychotherapy plus psilocybin, which is the psychoactive compound in magic mushrooms. And after 8 months, receiving only 2 sessions, the incidence of drinking alcohol went from 5 drinks to 1 per day. So 5 drinks per day is pretty heavy use. And in those who only had the psychotherapy, still a favorable impact from 4 drinks to 2. So this tells us either intervention could work. Perhaps we could say, try psychotherapy first. If you don't see the results that you need, then consider psilocybin-assisted psychotherapy. And there was no difference in the adverse events. And these authors concluded psilocybin plus psychotherapy produced robust decreases in alcohol consumption over and above those produced by placebo and psychotherapy. So coming to mindfulness, long COVID was studied and evaluated as to whether guided meditation plus color therapy would be any more effective than control. And they found after 5 weeks, the subjects experienced improved fatigue, anxiety and depression, sleep quality, and cognitive function. So hopefully it's becoming clear that if you're struggling with addiction, eating disorder, long COVID symptoms, there really is something to mindfulness, meditation, even something like EFT technique. So if this is a therapy that's not in your current care plan, consider adding this or at least speaking with the clinician to advise you on where to go. And you really may see the needle move when you start integrating these therapies. It's important to not only rely on supplements to get there. I think diet and supplements in the space of integrative and functional medicine are kind of over leveraged, and they have a time and a place, yes, but exercise and mindfulness should be equally as emphasized, in my opinion, given some of these data. Also depends on the symptoms that you have, but nevertheless. Within that same realm, 43 ulcerative colitis patients were randomized to either placebo or a mindfulness practice. It was a 2-month intervention. And interestingly, after a 1-year follow-up, there was a flare rate of 22% in the placebo group, but those who had done a 2-month course in mindfulness and likely maintained some degree of that going forward, the rate of relapse was brought down to 0. So pretty remarkable stuff. Now, we've also discussed similar findings where the use of an elemental diet to replace about half of one's calories per day for 12 months cut the relapse risk rate in half. So if we start putting these things together, as we advocate for, mindfulness plus elemental dieting in this hybrid application, perhaps 2 times per week, you take a walk in nature, you also exercise, you also use probiotics. This can be the difference between someone who might need a biologic drug or a 5-ASA class drug and who won't. Again, always check in with your doctor on these things, but to present you with some of the alternative options, here are some of the data that support the effectiveness of these things. And just via a quick search, you can see when you type the term mindfulness, there's Headspace, there's Calm, UCLA has an app also. So there's a number of options on offer for you to get started. Okay, coming over to cardiovascular health. Coffee, such a contentious topic. Observational study. So we have to be careful with observation because it's not randomized. And I also don't believe, could be wrong on this, but I don't believe this study controlled for healthy user bias. So there's no kind of regression analysis done. But nevertheless, nearly 500,000 subjects, 12.5-year follow-up. And what they found was compared to no coffee at all, those who consumed coffee had a 11% risk reduction for cardiovascular disease and a 17% reduction for the risk of all-cause mortality, death from any cause. Also, the benefits were not caffeine dependent. The favorable outcomes persisted whether they were drinking caffeinated or decaf coffee. As an aside, with coffee, unfortunately, it's gotten pulled into this, sandbox of, well, you shouldn't drink coffee because of the mycotoxins or the acrylamides. And okay, well, I'll trade you those two for 2 healthy mechanisms, which would be cholinergic acid and diproteins, which are antioxidants and anti-inflammatory. We can throw sand all day regarding mechanism. As a healthcare consumer, you have to ask for, what do the outcome data show? This tells us the net effect of the myriad of mechanisms that are influenced by any food or any supplement. So in this case, we see a 11% reduction in cardiovascular disease and a 17% reduction in death from any cause. So don't be duped by the mycotoxins or the acrylamides are going to kill you. Okay, well, show me the data, right? We learned this. We've all taken the same coursework in medical research and stats. So we shouldn't be making the really sophomoric mistake of arguing over what mechanisms coffee influences. And we should say, hey, if someone like you drinks coffee or does not, what happens? That's what you care about. In this case, you have a lower chance of dying from any cause and you'll have less heart disease if this sample of about 500,000 people is correct. And other data also support this. So that is the long short. Enjoy coffee. Don't sweat the mechanism. Omega-3s. A meta-analysis of 28 randomized control trials and about 140,000 individuals, control versus omega-3s, and compared to omega-3s, there was a reduction of cardiovascular events, 6%, and cardiac arrest, 8%. There was no effect on heart attack, stroke, or all-cause mortality. I should also mention that a meta-analysis recently found that omega-3 supplementation increased atrial fibrillation risk. And I will say personally, I think I was over supplementing with omega-3s for a while and was noticing I was having palpitations. I never had them diagnosed. I don't know if they were PVCs or what they were exactly, but I can tell you that when I stopped consuming fish oil, those went away, that this feeling of a heart flutter went away. So there's a few things here to take into consideration. And if you're experiencing heart flutters, if you've been diagnosed with AFib, or maybe they're not sure exactly what it is, but you notice heart flutters, perhaps pull back on your omega consumption. If you have a family history, then you may want to consider supplementing to a certain point. So exactly what is the optimal dose, I'm not clear on at this point in time. Fish oil helps some things, has some risks associated with it. So you'll want to take this on a case-by-case basis and potentially speak with your doctor so you can parse, well, I have AFib, maybe you don't use fish oil. If there's no AFib, no history of AFib, and you're trying to go into primary or secondary prevention, then maybe that would make the supplementation with fish oil worthwhile. And along with cardiovascular health, blood pressure is obviously very important. And look at this great study. Okay, a meta-analysis, so 22 randomized control trials, and they examine control versus L-arginine, the amino acid. Arginine at 4 grams per day, which is a decent dose, fairly high dose, reduced systolic blood pressure by 6 millimeters mercury. That's not a huge reduction, but it is something. Also, there was no additional benefit when a higher dose of over 9 grams per day was used. And you've probably heard this, but part of what arginine does is increase nitric oxide, which causes vasodilation, which can lower blood pressure. There are also other studies showing that arginine can improve erectile dysfunction. Along with this, I wanted to point to a meta-analysis we discussed in the past. This was using hibiscus tea. Again, a meta-analysis of 17 studies, so it's not a cherry pick, it's not one small study. And they found that hibiscus led to about a 15-point reduction in systolic blood pressure when 1 to 2 cups of hibiscus tea were consumed per day. So if you have high blood pressure, or let's say you have erectile dysfunction, then you may need to improve your circulation. I think we could also argue, again, I'm speculating here, but that if you want to improve cognition, that blood flow may be improved by opening up the vasculature. So you could have 1 to 2 cups per day of hibiscus. You could also supplement with 4 grams per day of arginine. Safe, effective, and you may notice that you have lower blood pressure. Very likely you will. You may notice better erectile function, and you may even notice that your circulation in general improves, which could also impact your cognition. This next meta-analysis wanted to answer the question, is combining aerobic and strength training better than strength training alone? And this is an important question. As someone who tends to veer towards strength training myself, I'm always curious to know if I have a blind spot regarding how I'm designing my training per week. And what they found was that cardiovascular disease was reduced by 18% with strength training, but by 46% when strength training was combined with aerobic training. Additionally, all-cause mortality risk was reduced by 17% with strength training and 40% when strength was combined with aerobic training. So this is really important to help us understand that strength training should definitely be incorporated into your workout routine, and that cardiovascular training alone is probably insufficient. Remember, this is not a cherry pick. This is a meta-analysis of 16 studies. So this is very likely to be what you will experience, and therefore you should be aiming to hit at least this minimum that the researchers pulled out from this analysis. 30 to 60 minutes per week was found to be the most impactful. So this is kind of the minimum barrier to entry that you should hit. That's per week. That's not a very high bar, right? That could be 3 20-minute sessions of strength training. And even if you really enjoy and you prefer cardiovascular training, fine, make that the majority of what you do, but get in at least 30 to 60 minutes total strength training per week. As you can see here, there's about a 3-fold improvement in your protection for cardiovascular disease and also for death from any cause. Alrighty, well, that takes us through vitamin D and depression, fiber and depression, exercise for anxiety, and also exercise strength training for cardiovascular and all-cause mortality health, mind-body EFT to improve depression, why we should be so careful regarding how we discuss diets as they pertain to potentially development of an eating disorder, ketamine for eating disorders, psilocybin for alcohol, mindfulness for long COVID, mindfulness for ulcerative colitis, coffee and no need to be alarmed and actually that you can drink coffee. One point on the coffee, there was no isolation for mycotoxins in these studies. And while I appreciate wanting to have a high quality coffee, I also think it's important not to take everyone's word for it. And if someone is making the proclamation that you must have mycotoxin-free coffee, we should see some good evidence for that. Now, truth be told, I haven't looked too closely on how robust of a defense exists to suggest you must have mycotoxin-free coffee. But when I look at these data, it makes me not too concerned about the Lavazza coffee that I drink, Lavazza in blue, give them a shout out. I like it. It has good flavor profile. It's easy and convenient for me to obtain. I have no quarrel, again, with the mycotoxin free, but if it's being represented as being vastly healthier, that's when I'm not sure and I take a little bit of an issue. Also, I am someone who is definitely mold sensitive. So if anyone were to notice a difference, I think it would be me. So if you enjoy the mycotoxin free coffee, if you want to have that more premium product, fine. But let's say it's 30% more expensive and you're trying to save money where you can, then you may not need to worry about the mycotoxin-free aspect of coffee. And also omega-3 for cardiovascular disease, arginine and hibiscus. And also that you should integrate strength training into your weekly exercise routine at least 30 to 60 minutes per day. All right, guys. Well, this is Dr. Michael Russo, DC. I hope you found this helpful and that this allows you to tune up your healthcare practice, your healthcare plan, and become as healthy as possible. All righty. Talk to you next time.